Tonight, we are working to help protect your family as the state health department issues a health advisory alerting you about the measles outbreak throughout the U.S. and Canada. We told you yesterday the U.S. reported its first death from the measles in a decade. An unvaccinated school-aged child, according to officials from Texas, died from the measles this week. Outbreaks have been reported in Texas and New Mexico, with Texas state officials reporting 124 cases. Health experts saying most of these cases coming into the country by people who traveled overseas. Measles is highly contagious, which is why the state health department and Erie County Health Department are reminding parents about getting their children vaccinated. 7 News senior reporter Eileen Buckley talking with local health experts about why these vaccines are so important.
That's an incredibly contagious disease.
Measles is preventable.
Erie County Health Commissioner Dr. Gail Burstein tells me there hasn't been a measles case in the county since 2018, but she warns it is highly contagious.
This really affects the most vulnerable people. It affects children. We know that pregnant people can get very sick. Our older adults can also get very sick. People who are immunocompromised.
But experts say it can easily be prevented with a vaccination. Children 1 to 15 months are encouraged to get their first dose of the MMR vaccine, then another between ages of 4 to 6. However, Dr. Rachel Kaufman, a partner at Buffalo Pediatric Associates, tells me there's a lot of fear and misunderstanding about this vaccine.
What do you tell any patients that are hesitant to receive a vaccine?
There is no one size fits all to helping people see different points of view. I usually try to get them to talk about what is driving their particular fear.
Vaccination rates have dropped through the years, but here in Erie County, it's at 87%, higher than the state's 81%.
The state measures this looking at the percentage of children under the age of 3 who received at least 1 dose of MMR vaccine by the time they turned 2.
I asked both doctors what makes measles so contagious.
People who are incubating measles from, say, Texas, New Mexico, or somewhere else that has an outbreak, gets on a plane, all those people on the plane are exposed.
This one is the air, and they're very tiny viral particles, and it doesn't take very many particles to get infected if you don't have underlying protection.
Dr. Kaufman explains that measles begin with a fever, cough, runny nose, and sores in the mouth, all before the rash begins.
And it starts right here, and it spreads down the whole body like rain. And that usually happens 3 or 4 days after the first person gets sick.
Health experts tell me the vaccines are so important in preventing death and disease. Eileen Buckley, 7 News, Buffalo.